Hi, my name is Dr. Marty Nager, and I'm a Board Certified Periodontist. You may have been referred to a periodontist by your general dentist, a family member, or friend. This video will demonstrate what happens during a periodontal examination and consultation. We'll also talk about different treatment procedures that we do for our patients here in the office. What I'm going to do now is to put you back in the chair and do a complete exam. Nothing's supposed to hurt, so if anything bothers you at all, make sure you let me know. Then I will sit you back up, I'll explain everything to you, I will give you some treatment recommendations, and then you can do whatever you're comfortable with. Go ahead, open for me. Stick your tongue all the way out. I'm going to grab it and twist it. I'll keep my hands down. Good. Onto this side. Put your tongue on the roof of your mouth, please. Excellent. And that looks fine. After we've done the oral cancer exam is to check the teeth for mobility. So we do that with two mirror handles, and we just sort of basically push back and forth like this. And I like to get a feel for whether the teeth are tight or loose before I even go any further, just so I have an idea of what we're working with here. Then what we would do is we would take the little probe here, which again is just measured in millimeters, and we would go ahead and start in the back, and we would measure 5, 4, 7, 7, 4, 5, 5, 4, 3, 3, 3, 3, 3, 3, 3, and measure all the way around to try and find out how far underneath the gum tissue we can get the probe, because that gives me an idea of where the bone level is. After we've done that, we want to look around for some recession. In fact, here is an area down here, right next to the canker sore, where you can see that the gum tissue has receded further down here, and you can see that this tooth is actually longer than this tooth because there's been some recession of the gum tissue down to this level, and again, because of the tartar that's underneath the gum tissue, it bleeds very easily upon probing. What I'd like to do now is to explain to you a little bit about periodontal disease in general, and then I can be a little bit more specific about the numbers from your mouth. Everybody has plaque in their mouths. Whether you eat, whether you drink, whether you smoke, doesn't make a difference, although smoking makes the gum disease worse. Plaque is made up of your own saliva and millions of bacteria. Of all the bacteria that are in the plaque, there are two types that we worry about. One type produces an acid, the other type produces a poison. The acid eats away at the tooth and causes a cavity. The poison eats away at the bone around the tooth and causes infection of the gum around the tooth. Perio means around, dontal means tooth, so periodontal disease is disease around the tooth, which is the gum and the bone. Nothing to do with cavities, nothing to do with root canals, nothing to do with crowns. They're totally separate. So what you felt me doing was I took my little probe here, which is just a millimeter ruler, and I stuck it in between the gum and the tooth to walk it around and try and find out how far underneath the gum I could get the probe, because that gives me an idea of where the bone level is. Any of the numbers that are 3 or less are fine. Anything over 3 is a problem, which we'll talk about. So on the healthy side of the model, where there's no problem, the probing depths would be as follows: 333, 333, 333, 333. If I can peel the gum back and show you what you can't see behind there, that white stuff right there is the jawbone, right here. It's the function of the bone to keep the teeth in your mouth. It's the function of the gum to attach to the teeth and to seal tightly around the teeth to protect the bone from the plaque up here. The plaque builds up and grows. It grows down underneath the gum, where it breaks the seal of the gum to the tooth, crawls down below and behind the gum where you can no longer get to it. So even though you brush your teeth every day, you brush above the gum, and when you get your teeth cleaned, they clean above the gum and below the gum to level 3, but deeper than that they can't get to. So we go from that side of the model to this side of the model where everybody's happy, feels fine, there's no pain, no problem, but now the probe goes in deeper, and that tells me there's been some bone damage. So this would be 545, 5, 5, 6, 6, 7, 8. If the probe goes in that far under the gum, the only way that could happen is if there's been some bone loss. So again, let me peel the gum back and show you that's the bone damage that occurs by those bacteria chewing up the bone around the teeth. That causes the teeth to become loose. In fact, on the model here, this tooth is so loose it's going to have to be removed, even though there's nothing wrong with the tooth. No cavities, root canals, fillings, it's a good tooth, but the bone has been destroyed. When all the bone is destroyed, your teeth come out, you wear a denture, and then there's no more periodontal disease. We call the area in between the gum and the tooth the pocket. The bottom of that pocket is where the bone is. And the bacteria have caused bone damage all the way down to wherever the level is that's remaining. And unless we are able to get in there all the way down under the gum to remove the bacteria and the plaque from underneath there, the disease will just keep progressing. So what you need to do is you need to come back here for 4 visits, 1 for each quarter of your mouth at a time. You'll come in and we will get you completely numb so that you have no pain whatsoever. Once you're numb, we will be able to get our instruments way up underneath the gum tissue to scrape all of the plaque and the tartar and all the junk off the root surfaces. Since that's what's causing the gum infection and the gums to be fairly large, removing them will shrink the gums back up again, and then you'll come back and see me for a reevaluation, which is an appointment similar to today, after your whole mouth has been completed. Either way, once this treatment is done, you have to make a commitment for excellent daily home care, as well as getting your teeth cleaned every 3 months, which is 4 times a year for the rest of your life. You're someone who will now have a general dentist and a periodontist. That way we'll be able to take care of you and hopefully help you keep your teeth for a lifetime. This is an example of a reevaluation a number of weeks after the scaling and root planing was performed by our dental hygienist. You can see here that the patient had a lot of swelling, plaque, and calculus on the palatal aspect of her upper anterior teeth. Pocketing in this area was 6, 7, 8, and 9 millimeters. After the scaling and root planing, the pocketing is now down to 3 and 4 millimeters. The swelling is gone, the soft tissue is much healthier, and this will now be maintainable by the patient, having her teeth cleaned every 3 months. Sometimes gum grafting is necessary in order to be able to add tissue where there is no tissue, or to be able to cosmetically cover up an exposed root surface. This is an example of an upper canine whose root has been exposed and covered with a gingival connective tissue graft. This is an example of both connective tissue grafting on the upper arch and free gingival grafting on the lower arch. You'll be able to see that the upper arch cosmetic recession is covered, and you can also see now that there is a very nice amount of thick pink gum tissue on the lower arch where there was none before. This is an example of pocket reduction surgery. You can see from the first picture that the tissue around the teeth is swollen and red and unhealthy. After the surgical procedure has been performed, the tissue is pink, attached to the teeth, and much healthier. A crown lengthening procedure is something that is performed all the time in the office of the periodontist. Here is an example of an amalgam restoration that is going to be having a crown placed. The amalgam, as you can see here, is buried very far underneath the gum tissue. On the radiograph, you can see that the amalgam is down just about to the level of the bone, and there is still a little bit of decay underneath that. After the surgical procedure has been completed, you can now see solid tooth structure between the gum tissue and where the amalgam was. And that solid tooth structure now becomes the final crown margin for our final crown, which you can see here. This is an example of an extraction and bone graft. Simply enough taking out the tooth leaves this gigantic defect in the bone. That could leave not enough bone available for dental implant placement, and also an uncosmetic soft tissue result. By being able to place a bone graft into the socket at the time of extraction, we are going to be able to maintain the soft tissue as well as ensure that there will be enough bone present for dental implant placement down the road. This is an example of a single-tooth dental implant. This is a patient who was congenitally missing an upper canine tooth. A single-tooth dental implant was placed. 6 weeks later, the impression was taken by the restorative dentist, and here is an example of the final crown on the dental implant, both clinically and radiographically. Thank you for watching this video on periodontal disease and procedures performed in the office of a periodontist. For more information, you can contact www.riperio.com or speak to your dentist or periodontist.